And without further ado, I present Dr. Kelly Moore of Ripple Wellness.
Hi, thanks, Vanessa. I'm just gonna quickly share my screen and then switch on my PowerPoint. There we go. So hi, everybody. Thanks, Vanessa, for the introduction. My name is Dr. Kelly Moore. I am a naturopathic physician at Ripple Wellness, and tonight I'm going to be sharing with you a topic that I find super fascinating, estrogen and gut health. So without further ado, let's dive into that. Hold on a second. Here we go. Can you guys see, just a little technical note, when I get a notification that people are trying to enter the room, do you see that too, Vanessa? Hopefully not.
Yes, I do. And I've got that. I'll handle that part.
Okay, awesome. All right. So before we get started, just a couple of things. This webinar, the intention for this information is really to share information, to give you the opportunity to think a little bit about how that information might pertain to you and your own body, your own circumstances. So taking a little bit of inventory. And ultimately, I want you to walk away feeling inspired and empowered rather than thinking about, trying to be perfect, judging yourself, shoulding on yourself. So that's not what this is about. This is, just education and information for you to take forward. It's important to remember that I am a physician, but I'm not your doctor. So it's important to just take this information as educational. And if you want to implement any of it in more depth, to work with a physician. All right, so a little bit about me. I'm a naturopathic physician at Ripple. The focus of my practice is on using lifestyle medicine to treat and prevent chronic disease, including hormonal imbalances, digestive disorders, metabolic disorders, and things of that nature. Ripple Wellness is a multidisciplinary clinic in Washougal, and as well as naturopathic physicians, we have acupuncturists, massage therapists, nutritionists, mental health counselors, yoga and breath experts. And we're doing this wellness series once a month through the Camas Library. We also do other community events. So go ahead and put your email in the chat if you want to stay in the loop on those other topics. And I'll be sharing the next topic at the end of this talk. All right, let's get to know estrogen. This is a hormone that I know we've all heard of, but I imagine each of us will learn something new about it this evening. I certainly learned some new things when I was putting this together. Something cool about estrogen, the word, is that it derives from the Greek word oistros, which literally means inspiration. So that estro part is inspiration, and then gen is to generate. So this is a hormone that generates inspiration, it generates creativity, it generates life. So we are going to get to know more about it today. And we're going to start with, what is a hormone? Just so we're all on the same page. A hormone is essentially a messenger molecule. It is being secreted by a gland somewhere in the body, and it is moving through the bloodstream to the tissue where it's going to enter through a receptor. And those receptors are going to come back to are really important. If you don't see me right now, if you can just take a peek over here, just imagine my hands. Well, imagine a cell covered in these little receptors for all different kinds of hormones and neurotransmitters. And you have an estrogen receptor or multiple estrogen receptors on particular tissues that are kind of waiting to grab onto some estrogen. All right. In the case of estrogen, we are talking about a steroid hormone. Most of our sex hormones are going to be steroid hormones, including estrogen, and that means they come from cholesterol. And I like to mention that just because cholesterol gets a bad rap, and it is important. We need a certain amount of cholesterol. When we have excess cholesterol, that's associated cardiovascular disease. However, insufficient cholesterol means you just don't have enough material to make the hormones that you need. So let's take a look at that. I know your eyes are glazing over. Don't worry. I just want to give you a kind of sense of the complicated processes involved in steroid hormone production, but I'm not going to test you on this. We're just going to talk about three of these particular compounds. We're going to start with cholesterol. So you see cholesterol up here at the top. And you can see how it is where all of this begins. And the pathway we are particularly thinking about now is it moving to DHEA and then to estradiol. Estradiol here, we'll talk more about that. It is our most potent form of estrogen. So this is, again, a complicated pathway, multiple hormones here, including progesterone and testosterone, which you can't really see well. But for today, we're just focusing on estrogen. And it's important to remember that it comes from cholesterol. So where is this happening? Well, for most of our lives as women, if we have ovaries, then the estrogen production is happening in our ovaries. However, all humans have estrogen, have and need estrogen. And for those who don't have ovaries or whose ovaries aren't producing estrogen, then the primary tissue of origin for estrogen is actually our fat tissue, our adipose tissue, which is one of the reasons we start to put on weight after menopause. When our ovaries stop producing estrogen, our body wants estrogen. And so it's just making more fat so we can make more estrogen. We also produce estrogen in our adrenal glands, which are these little kind of like hat-shaped glands on top of our kidneys, where we make cortisol and other hormones. We make a little bit of estrogen there too. And then in the placenta during pregnancy, we also make estrogen. Where does all this estrogen go? Well, like I said, I mentioned those estrogen receptors. They're on lots of different tissues in our bodies. The first one we tend to think about is our uterus, right? Most of us know estrogen has something to do with our menstrual cycle. We may not know exactly what, but we're thinking about the uterus and its impacts on the uterus. But estrogen receptors are also found in the urinary tract, in our bones, our hair, our skin, even our brain. It's found, estrogen receptors are found in our heart and blood vessels as well. And what is it doing there? Well, I like to think of estrogen as kind of the Beyonce of hormones. So estrogen, if you want to think of some words that kind of go with estrogen, you can think of voluptuous and juicy. So one of the things that estrogen does is it is responsible for triggering the development of female characteristics, including breasts and hips. So it also, so it's kind of a full and building hormone. It builds up the uterine lining in the first half of our menstrual cycle, getting that uterine lining nice and cushy and prepared for the plantation of a fertilized egg. Now, estrogen is also, as it's building up this uterine lining, it's also getting other parts of our body ready to be, to allow for that egg fertilization. So ready for sex, essentially. So it allows for vaginal lubrication. It sensitizes the genitals, and it can make our skin glow. It can make our features more symmetrical. It can make us more confident and creative. So these are some of the most well-known traits or roles of estrogen. However, it has a range of other really important roles in other tissues as well. So I mentioned there are estrogen receptors in the uterus, in the urinary tract, and that helps to maintain urinary continence. When we have insufficient estrogen, we start to have urinary incontinence. It helps to preserve bone density. It actually slows down the activity of the osteoclasts, which are a type of cell that break down bone. So it helps to preserve bone density. It maintains skin elasticity and stimulates hair growth. It helps to sustain normal body temperature. And it supports insulin sensitivity. Insulin sensitivity is huge. It's very important. In fact, that's going to be our next wellness talk here at the library next month. Is going to be about blood sugar and insulin desensitization. It's very important that our cells remain sensitive to insulin. As that starts to fade, we start to head in towards diabetes. And then cholesterol balance is very closely related to insulin, too much insulin and the resulting inflammation. So estrogen also helps to adjust serotonin and dopamine. So it is very intimately connected to our mood. And some less desirous effects of estrogen, it's a procoagulant. So it increases clotting factors in our blood that form clots. So sometimes when if you're menstruating, you may notice some clots coming out as part of that menstrual flow, and that can happen in other parts of your body as well. When you have excess estrogen, you can be more prone to clotting. Another thing that it does is it thickens bile, and we're going to talk a little bit later on when we're talking specifically about the digestive system. We're going to talk about estrogen in the gallbladder a little bit, but excess estrogen will make you more prone to gallbladder disorders because it's thickening that bile and making it harder for the gallbladder to squeeze it out. So we have been talking about estrogen as if it's just one thing, but actually there are lots of different kinds of estrogens. And the first division of estrogen that we're going to kind of talk about here is endogenous versus exogenous. So endo means in. So we're talking about and on this slide, we're talking about hormones, estrogens that are made in our own bodies. And there's actually 3 types. So we have, first of all, estradiol, E2. And that was the one I highlighted on that hormone pathway slide. Estradiol is our strongest estrogen. It's our most potent estrogen. Another way to say that is it is our most estrogenic estrogen. It is produced primarily in the ovaries, and it is our most predominant estrogen from puberty to menopause. However, we have 2 other types of estrogen. Estrone, E1, it's weaker. It's more inflammatory though. And I'll show you that in a little bit, how it's more closely related to an inflammatory pathway. It is made in the ovaries, the fat tissue, and the adrenals. And then we have a protective form of estrogen called estriol. You may have heard of this if you are using hormone replacement to treat urinary incontinence or vaginal dryness. You can just use estriol topically. It's also often used in combination with estradiol as a biased. So if you're using a patch or if you're using a compounded cream, it's likely a biased, and that's going to be estradiol with estriol. It's actually mostly made in the placenta during pregnancy. So these are the estrogens that we make, but there are estrogens in our environment, exogenous estrogens. Exo means outside of our own body. And these play a huge role in our body's overall estrogen burden, which is why I bring them up, because they're everywhere. And if you imagine those receptors that I talked about, they bind to the same receptors as estrogen. So our body doesn't differentiate necessarily very well between our own estrogens and estrogens that come from the environment. And in fact, some of these estrogens have a stronger and more estrogenic effect than our own estrogen. So where are these coming from? I think actually, let me just quickly talk about the effects. It can bind to that receptor and have a more potent estrogenic effect, or it can bind to that receptor and just block it from our own estrogen. So either way, it disrupts our hormonal balance. These xenoestrogens can also damage the estrogen receptors, which means if we have damaged estrogen receptors, even if we're producing sufficient estrogen, we may not be able to use it. And then worst of all, these estrogens, when we talk about detoxification of estrogen further on in this presentation, it's important to remember that our body does not detoxify xenoestrogens. They build up in our fat, and then they kind of hang around for longer and have longer term effects in our body. So where do these come from? Unfortunately, they are everywhere. Here's just some examples. They're in pesticides and herbicides, which get into our food supply and our drinking water. Plasticizers, you may have heard of BPA. That's one plasticizer that happens to have a lot of research behind it as being estrogenic, being a xenoestrogen, or what's called an endocrine disrupting chemical. It disrupts our hormones. But there's many other plasticizers that are also xenoestrogens. Interestingly, cashier's receipts that some of you, I used to live over in Seattle where there are a lot of stores called PCC, and they changed their receipts actually to be kind of yellow. And the reason they did that is because the traditional cashier's receipts or airline tickets, the ink that is used on those has a lot of xenoestrogenic chemicals in it, and that is affecting primarily women. So it's actually a significant enough effect to cause notable health issues in those populations of cashiers and people working for airlines. And so some stores are changing that, but most stores still use those receipts. And so it's better to kind of try not to touch that ink when you grab onto your receipt. Skincare products, another source of plentiful xenoestrogens. So as you can see, they're really everywhere. And we also have heavy metals that have estrogenic effects, so metalloestrogens. And then mycoestrogens. Myco means fungus, and again, or mold. Over on the west side, mold is a huge issue in homes, and mold produces mycotoxins that can be problematic for certain people. And some molds will produce mycotoxins that actually have an estrogenic effect, that are binding to those estrogen receptors and either blocking or having a more potent estrogenic effect on the body. So just, take a deep breath, take a step back. Don't worry too much. Our bodies can detoxify some of these, not all. And our bodies can detoxify our own estrogens as well. But it is really important to be aware of these, especially if you start to have symptoms of excess estrogen. It may not be coming from your own body. There's a reasonable chance, depending on your exposure, that it could be coming from the environment as well. So, more exogenous estrogens. So these are phytoestrogens. These come from plants. And phytoestrogens can be beneficial or they can be harmful. It kind of depends on what your body is needing at the time. Phytoestrogens have a weaker estrogenic effect. They bind to the same estrogen receptors, but they have a weaker action. So this can be beneficial if you do have excess estrogen, or you are exposed to xenoestrogens. If you're taking phytoestrogens, they will bind and block those more potent or more toxic estrogens from binding to the estrogen receptors. So that's one benefit of phytoestrogens. And then if you are menopausal or postmenopausal and you have very little estrogen production in your body, even a weaker estrogen can help reduce symptoms of low estrogen. So where do these healthy phytoestrogens come from? Flax is a really good source. Soy is actually a very, one of the more potent phytoestrogens. The problem with soy is the way it is processed and grown. So if you're eating kind of a, heavily sprayed, non-organic, very processed soy product, it's not going to be, the benefits of that phytoestrogen are going to be outweighed by all the detrimental effects of the processing and spraying of that soy. However, if you're having a whole form of soy like edamame or minimally processed miso or tofu, and it's organic, so it hasn't been heavily sprayed with Roundup, then that can be a really great source of phytoestrogen. And then there's certain herbs, you may have heard of things like maca, that have an estrogen effect as well. Now, there are unhealthy sources of phytoestrogens. These would include those highly processed and sprayed soy foods, also conventional meat and dairy, where those animals are eating the highly processed soy. It's being stored in their tissues, and that phytoestrogen effect can be passed on to our own bodies. All right, so even more sources of exogenous estrogens here. These are not necessarily xenoestrogens. I mean, they are exogenous, but they're not known as xenoestrogens because they're not. They're estrogens. They just come from a different place. And so conventional meat and dairy products are treated with hormones, and those hormones stay in the tissue, and then they can impact us. And then birth control has estrogen in it. And this can be an issue not just for women who are on birth control, but it can get into the water supply, and it can impact men and anyone who's drinking the water. It's not filtered in water plants. Pharmaceuticals are not filtered out of water when it's treated at water plants. So we're exposed to those pharmaceuticals that have been excreted through the urine, and birth control is one of those. So lots of estrogen coming from inside of us and outside of us. some takeaways from this particular section of the talk. Estrogen acts on many different tissues of the body. It has really important effects on lots of different tissues, not just our reproductive organs, but there's a Goldilocks kind of zone. You don't want to have too little estrogen, but you also don't want to have too much estrogen. And we can be exposed to estrogen from our environment and estrogen-like chemicals, but also in from certain plants. Okay, what happens when estrogen gets out of whack? Well, let's have a look at this. What happens when you have high estrogen? Think about those tissues where estrogen is acting, and these symptoms will make sense. When you have too much estrogen, you can have breast tenderness, endometriosis, where you're having growth of uterine tissue outside of the uterus. That's very painful and inflammatory. Heavy periods, shorter cycles, less than 21 days, menstrual migraines, mood swings, PMS, irritability, anxiety. One thing I learned about estrogen is it blocks the breakdown of some of our excitatory neurotransmitters. It slows that breakdown down. And so when that breakdown of excitatory neurotransmitters is slowed down, we can feel anxious. And so that is one of the ways that estrogen can promote anxiety. Fibroids, ovarian cysts, bloating and water retention, weight gain, especially in our hips and our butt, and increased bra size and gallbladder problems, as well as clotting. If you're seeing big clots in your menstrual flow, that's a sign of excess estrogen. I want to mention estrogen dominance because this is a condition that I see a lot in my practice. It's it's quite common because of all the things that can lead to it. And estrogen dominance is essentially just having these symptoms of excess estrogen. So if we go back here and look at this page, if you have some of these symptoms, it's possible that you have estrogen dominance, but that is not the same thing as having high estrogen. It can be caused by high estrogen, estradiol in particular, but it can also be caused by too many inflammatory estrogen metabolites. So these are breakdown products of estrogen that are inflammatory and in some cases toxic. And if those get recirculated in your body, they can cause those symptoms of estrogen dominance. It can also be caused by excess exposure to environmental or xenoestrogens. And then the third way you can get those symptoms of estrogen dominance is if you don't have enough progesterone to balance out the estrogen. We're not talking about progesterone today much at all, except for right here, but progesterone is kind of the counterpart to estrogen, and it's very important to prevent the symptoms of excess estrogen. So you can actually have low estrogen. You can be heading into your menopausal or postmenopausal years and having declining estrogen production, but if you have even lower progesterone, then you can still experience symptoms of estrogen dominance or estrogen excess just because you don't have enough progesterone to balance out that estrogen. So I just wanted to make a note of that, this sort of symptom picture, because I see it a lot in my practice. Okay, low estrogen. Let's look at these symptoms and see what they remind you of. So we've got poor memory, emotional fragility, irritability, anxiety, depression, low libido, vaginal dryness, urinary tract infections or irritation, or even just a leaky or overactive bladder, loss of bone density, achy joints and joint injuries, headaches, wrinkles, droopy breasts, sun damage, night sweats and hot flashes, a scanty period or no period, thinning hair, weight gain. So none of these are fun either. So it's important to have some estrogen to prevent some of these symptoms. And when we don't have those, we feel it. And this is a lot of women will feel these symptoms in that transition to their postmenopausal years when estrogen production crashes and the body hasn't quite ramped up production of estrogen from other tissues. And also it's kind of just like symptoms of being old, right? Wrinkles, droopy breasts, thinning hair, achy joints, like this is what happens. And I think this is an important place to kind of just acknowledge that getting old and becoming perimenopause, postmenopausal, these are not diseases, and it's important not to pathologize them when we talk about treating menopause. However, it's also important to acknowledge that through most of human history, we didn't live very long postmenopausally, if we ever got to that stage. For much of human history, people died in their 30s, 40s, 50s. So the amount of time that women would have lived with these symptoms wasn't very long. And fortunately, we live in a time where our life expectancy is a lot longer past menopause. We can expect to live, 2, 3, 4 decades past menopause. And that's a long time to live with low estrogen. So just something to think about as you think about transitioning from your premenopausal to postmenopausal. If you're already there, thinking about managing that. That I would love to do a talk on menopause at some point because there's a lot to dive into there. But it's really important, especially to think about protecting bone density and protecting your heart and insulin. I didn't put that here, but we talked about insulin resistance developing with low estrogen. So those are things that can end up leading to further disease. Okay, you will notice I didn't really mention the gut much at all yet. The gut and the liver are where estrogen metabolism happens. So let's look at that. This is the path of estrogen, in a healthy microbiome, but you could also sub here a microbiome with a healthy liver function, healthy bowel movements. This is what we expect to happen. We have our estrogen produced in our ovaries or, wherever else in our fat. It goes to the body tissues. It's absorbed through the receptors. It's excreted back into the blood, and it goes to the liver. There are 2 steps of estrogen metabolism that happen in the liver. And then that metabolized estrogen gets dumped into the colon. So the colon is the large intestine. It's like a big upside down U under your rib cage. And that's where your poop is made. So what happens in a healthy functioning system is that most of the estrogen that is dumped into the colon is going to exit your body. And some of it is going to go back and be recirculated. However, if you have an unhealthy microbiome, which we'll talk about in a minute, but also if you don't poop every day, or even if you're having, suboptimal bowel movements, which we'll talk about in a minute, if you don't have appropriate sufficient nutrients to allow for proper liver function, or if your liver is overburdened by other toxins like heavy metals that it's prioritizing, what will happen in those cases is some of your estrogen will exit the body, but most of it will go back to the body and recirculate. And it's important to know, and we'll talk about in a minute, that this recirculating estrogen is often more toxic than the original estrogen that was excreted into the liver. And so you can have an exacerbation or an intensification of those estrogenic effects. So let's start with phase 1 of estrogen metabolism. This is happening in the liver. This is called oxidation. And this is essentially taking your fatty hormone. Think about like a little glob of oil. It doesn't move very well in water. Our blood is aqueous. Our blood is water. And so is our bile, and so is our urine. And we really want that our bile, is not aqueous, but our urine is. And we want those hormones to be able to move in those environments. And so we take them through this process called oxidation to make them water soluble. Now, there are 3 potential byproducts of this oxidation. And what's interesting is that one of them results in a compound called 2-hydroxyestrogen that's protective. And you could call it a clean estrogen. However, there are 2 other potential pathways that could occur and result in other forms of metabolized estrogen known as 4-hydroxy and 16-hydroxy that are more potent and also in some ways toxic. You can think of them as dirty estrogens, are associated with increased risk of breast cancer, prostate cancer in the case of 4-hydroxy when this is happening in men, men's bodies or people with prostates. So these estrogen metabolites, we don't want them hanging around for very long. We want them to get out, but when they're in this form, right as they are, when they've been oxidized, they can be very toxic. And so what our liver does, and I'm just going to put a pause here because I want to show you, you can actually measure this in your own urine. You can look and see how much of the estrogen you're excreting is going to be that 2-hydroxy, 4-hydroxy, or 16-hydroxy. And that can help you understand if these enzymes are being sufficiently are active enough, or maybe even overactive, and you're pushing estrogen down these more toxic pathways. So nutrients that are important for this pathway are going to be B vitamins, glutathione, flavonoids. Flavonoids is an antioxidant that comes from yellow plant foods like onions and peppers and things like that. And then DIM is a compound that comes from cruciferous vegetables, and that's things like broccoli and Brussels sprouts and cauliflower. These are all nutrients that the liver needs. If you go back here, the liver needs, for these enzymes to function, it needs these nutrients. If you don't have enough of these nutrients, or if they're being used to detoxify other chemicals, then your estrogen will perhaps not get detoxified. So when it's been oxidized, it is then conjugated. And that's essentially, you're taking that estrogen, that toxic form of estrogen, and you're combining it with another molecule so that it can be safely excreted through your bile, your urine, or your poop. And you need other nutrients for this. Some of them are the same, like these B vitamins. You also need things like vitamin C, magnesium, a lot of different amino acids here, cysteine, glycine, methionine. Sulforaphane also comes from the broccoli family. Now, this process, this phase 2 of detoxification, can be inhibited or slowed down by certain medications like oral contraceptives, proton pump inhibitors, ibuprofen, things like that. It can also be slowed down by too little of these nutrients. And then what happens is you get this kind of toilet blocking effect. So ignore these words in red for now. These are just different kinds of nutrients that work on these different phases. But the reason I put this picture in here is because I think it helps to visualize your liver kind of as a toilet, right? It's processing waste. And the first stage of that detox is kind of opening up this connection here from the toilet to the rest of the pipe. So this is the part that gets blocked if people use too much toilet paper. This is the part you can use a plunger to kind of unblock. And if this is working well, then that waste is going to continue down the pipe. But you want the rest of the pipe to be open. And that's where that phase 2 detox comes in. If that phase 2 detox isn't working, but phase 1 is, then you get a backup of waste. And you have this phase 2, this pipe that is clogged. And so that waste goes back up into the toilet, and that can cause symptoms. So part of this phase 2 is making sure that you have enough bile from your liver or your gallbladder to bind that detoxified estrogen too. So you want your your inactivated estrogen to be bound to bile, and that so it can be excreted into your colon to poop. The problem is if you don't have a gallbladder or you have insufficient bile production, then that's not going to happen as efficiently, and that can result in symptoms. And then the estrogen itself can actually make that problem worse by making that bile so thick and sludgy that the gallbladder can't excrete it, leading to bile stones, inflammation of the gallbladder. So gallbladder plays an important role here, as does bile. You could be pooping really well, but if you have insufficient bile production, you could still have problems with your estrogen metabolism. So we talked a lot about liver here. Let's go to the colon. What's happening in the colon with estrogen? Well, first of all, we have that inactivated estrogen and the bile being dumped into the colon. So you can kind of, if you go back to that toilet analogy, kind of imagine the colon like the sewer, right? The waste is going out of our house and it's being dumped into the sewer. And the expectation when we flush our toilet is that our waste is going to go to the sewer, and the sewer is going to carry it away to the wastewater treatment plant. Our body kind of functions the same way. It's dumping waste into the colon. It's expecting that that waste is going to be removed and taken out of the body. That really depends on if you're pooping. If you're not pooping, that's not going to happen. So it's important to be having at least one daily bowel movement, and that bowel movement should be well formed, like a log. It should be easy to pass. It shouldn't have mucus and be slippery. Definitely shouldn't have any blood. So, our bowel movements are an important indicator of our health, and our colon is a really important organ of detoxification. So it's very important for so many different conditions, including hormone health, that you're having a daily bowel movement. When those estrogens aren't eliminated, if you aren't having a daily bowel movement, they can be reabsorbed through the walls of the colon, and then they just go back into your body and recirculate. So what else is happening in our colon that relates to estrogen? Well, this is where we start to talk about the microbiome. So we're going to kind of just zoom way out. Our microbiome is a collection of microorganisms. It's a whole ecosystem of microorganisms, bacteria, fungi, viruses that live in almost all of our body has a microbiome. We have a skin microbiome, an oral microbiome, and we have a microbiome in our colon. We have a microbiome even in places like our lungs and our bladder. Today, we're talking about our gut microbiome, and we're specifically talking about the microbiome in the colon. In the colon, we have what's called an estrobolome, and it's a particular subset of that gut microbiome that helps us to metabolize estrogen. And this is getting a little bit down in the weeds here, but those organisms are going to be producing an enzyme that helps to separate estrogen from what it was bound to, so that it can in some cases be recirculated. But we don't want too much of that happening, right? So much of this with hormones is really about finding that sweet spot in the middle, not too little, not too much. The same is true for this beta glucuronidase enzyme that's produced by the organisms in our estrobolome. We want to have a little bit of it, but we don't want to have too much, because when we have too much, we separate too much of that toxic estrogen from that protective molecule that was keeping it from causing damage. And that toxic estrogen then recirculates in our body and causes harm. How do imbalances in the microbiome occur? And this is general to the whole microbiome. It applies to the estrobolome as well. Antibiotics will disrupt the microbiome, but so will a lot of other things that may not be as intuitive, like chronic stress. Has been shown to alter the microbiome. Low fiber, so our microbiome particularly the bacteria in our microbiome, they feed on fiber. So a standard American diet is very low in fiber, which means you're essentially not feeding those organisms. They're not getting what they need. So that environment is going to be disrupted. Steroid use, lack of exercise, poor sleep, all of these can impact the microbiome. And I'm just going to do a quick time check here. Hold on. Okay, so let's zoom out. Let's kind of summarize what we just talked about here. We're talking about essentially poor gut health impacting our hormones. That is the message really that I want you to take away from this talk, is that poor gut health will impact your hormones. If you have hormonal imbalances, it's important to address your gut. Why? Well, first of all, our gut is where we absorb nutrition. So if we have inflammation in our gut, if we're not absorbing nutrition, we are going to struggle to make our hormones and detoxify those hormones. Gut inflammation will lead to stress, which will lead to increased cortisol, which down regulates those hormone receptors I talked about. So like I said, you could be producing all the estrogen you want. If you don't have enough receptor, then it can't bind and act on the tissue. And then imbalances in the estrobolome, that part of the microbiome that is specific to estrogen, can lead to too much or too little beta glucuronidase, which can lead to too much or too little circulating estrogens. And that has been shown to increase risk of estrogen-related cancers, endometriosis, and polycystic ovarian syndrome. Poor liver health also impacts hormones. When we have poor liver health, we don't store nutrients as well, which leads to impaired hormone production. And as we just talked about in detail, when we have poor liver health or insufficient nutrients for liver detoxification, then that can lead to inflammation and or estrogen dominance. So what can we do about all this? Well, it's important when we're thinking about lifestyle changes to support healthy estrogen metabolism that we think about that as that estrogen metabolism, those phases in reverse. So you want to start with phase 3. You want to make sure you're pooping. That is the first thing. You want to make sure that you have a balanced microbiome. So if you're experiencing a lot of bloating, gas, even other subtler symptoms, abdominal pain, there are many different non-gut symptoms that can be signs of an imbalanced microbiome, but you want to balance your microbiome. And I like to think of your microbiome as a garden. So you want to weed out any weeds, any overgrowth. You want to plant using probiotics, and you want to fertilize using soluble fibers in food and potentially in supplements. Then once you've got everything in the colon working well, if you're still struggling, then think about support for phase 2. So you're working back up through that toilet. You want to make sure before you open up the toilet bowl, you want to make sure the pipe is cleared so you don't have waste going back up into the bathroom. So that's supporting phase 2 detoxification. There's particular nutrients for that. And then you support phase 1 detoxification. You can do all of this with food. You can also use supplements to help support these, opening up these pathways. Now, when we're talking about hormone health in general, it's just really important to think about eating a wide variety of colorful plant foods. That's where we get all of those minerals and vitamins and antioxidants that support hormone health. We didn't talk about this today, but it's important to have balanced blood sugar for hormone health. And to have balanced blood sugar, it's important to have a healthy ratio of vegetables to starchy carbs to fat. So you want to think about having protein, fat, healthy fats, and fiber at all of your meals to balance out any of those starchy carbohydrates. And we'll talk a lot about that in our next wellness series in October, in September. You want to think about your environment, avoiding those xenoestrogens. Here's some good resources for doing that. Environmental Working Group has a website that will lead you to give you a list of good water filters, give you a list of the most heavily sprayed crops. Those are the dirty dozen to avoid. And then the least sprayed crops are the clean 15. They even have an app you can use to put in your skincare products, ranging from sunscreen to lipstick, to look and see if they have xenoestrogens or other chemicals in them. And then you want to keep all your detox pathways open. That includes your skin, and sweating is one of our most important ways to detoxify. We want to be urinating regularly, and also deep breathing is a way to detoxify. And then finally, we really want to not forget about sleep. Sleep is when our liver detoxifies. It's when we have cellular regeneration. Melatonin production is actually anti-inflammatory and also anti-estrogenic. And then stress management. I can do a whole talk about that too, but essentially you want to, when you are in a stressed state, you're actually preventing your body from focusing on hormone balance. So practicing stress management is really, really important for hormone balance. If you want to take a deeper dive into any of these issues, you can schedule an appointment with me at Ripple, and here's a way to contact them. Another fun way that I'm really excited about to take a deep dive into these topics is I'm going to be hosting a 5-day retreat that is only on the topics of gut and hormone health. It's called Glowing Guts. It's going to take place in the Methow Valley where I live, which is northeastern Washington. It's a beautiful part of the state, September 21st through 25th. And you can register here. There's actually a promo code until the end of August that I will have Vanessa send out, but it's also on the website that will give you $150 off. It's Summer Glow. So just capital Summer Glow, GLOW all together is the code for that. So yeah, if you want to really take a deep dive into hormone and gut health, this is going to be a really fun way to do it. And then finally, our next topic in the wellness series, as I mentioned a couple times, is going to be about blood sugar. Aside from hormones and gut health, blood sugar is one of the things I talk about most with my patients. Blood sugar, when it's elevated, is very inflammatory, very aging at the root of so many chronic diseases. So it's very, very important to keep it balanced, and it affects our hormones too. So that's going to be on September 14th at 6 o'clock. All right, I'm going to hand over to Vanessa, I think, to see if anyone has questions.
So feel free to either put your question in the chat, or you can unmute and ask as well. I see Joan raising her hand.
Trying to figure out the technology. I got it. I think you can hear me.
Yes.
I wonder is the 14th session going to be through Chemist Library too?
Yes, good question. That is going to be through Chemist Library. The blood sugar one. Okay,
so I can look on that and sign up for that. And I had somebody come, so I missed all about liver, which I like. You said something about you tape this. Is there any way we can get a copy of this tape, or?
Yeah, Vanessa's going to be sending that out, I think, potentially tomorrow, right, Vanessa?
Correct.
To all of us?
Yes.
Oh, that's fabulous. Yeah, it's fabulous, because I can't ignore someone at the doors. Thank you. More questions later. Oh, and when you send that out, there will be all the emails and numbers and stuff.
Yes. You'll see that there.
Thank you.
We had a question here. If we can't attend a class, will there be a way to access the recording? Vanessa, can you clarify, do you have to be registered to receive the recording?
Yes. So if you would like to receive the recording of any of these, it is important that you do register so that we have the information to be able to send it to you.
It looks like Nancy's raising her hand. Do you see that, Vanessa?
Can you hear me?
Yes. Hi, Nancy.
Hello. I may have to have a total hysterectomy. How harsh is that on the system for women? I'm 67.
Yeah, you're 67. So your ovaries have stopped producing estrogen a while ago, likely. And so your body has actually hopefully learned to compensate for that in other tissues. So it may not be as harsh of a transition as it would be for women who are younger and have a hysterectomy. And there's the whole surgery aspect of it, which I know can take require recovery. Which can take a while. However, in terms of the hormonal impact, removing the uterus and the ovaries after menopause is much less of an impact than when you remove it before menopause.
Thank you.
Help? Yeah.
Yes, thank you. Thank you.
Let's see anybody else. I don't see anyone else raising their hand. Are there any other questions? Well, looks like there's not, Vanessa.
Okay, so I'm going to stop our recording.